I'm Dr. Chuck Smith here at HealthPark Dentistry. With me today is Sean Brown. We're going to talk about dental Medicaid and how we have been able to build relationships with people rather than just fix their teeth. So, Sean, let me ask just some background questions.
Okay.
So, when's the first time that you saw a dentist?
I'm not sure what age. It was probably about 5, and it was you here in Tip City.
So it has been a few years, yes.
Yes.
And what did you come in for then? Do you remember anything about that?
Back then, my dad, our family had good insurance. It was in the early 70s. And I came in and we were getting fluoride treatments regularly. And I ate a lot of candy. So I had a lot of cavities, some in baby teeth. And then as we progressed, I ended up having orthodontics from Dr. Murphy and continued to see you till I was about 18 or 19, and that's when I left home and I wasn't on that insurance anymore.
What happened after high school?
After high school, I think I continued on my parents' insurance through college. After that, I had insurance again, but by about the year 1998, 99, things started changing with healthcare. I know the prices we paid got greater. I went through a divorce and took another job. So at that time, it was maybe you have it, maybe you don't. And from probably the year 2000 until last year, which would have been 2011, I haven't had any insurance, medical, dental.
So what did you do when you didn't have insurance?
I didn't go to the dentist. I went to the doctor when I was sick, when I couldn't work.
So how long was that span in there where you weren't going to see a dentist?
In 10 years, I saw it, 8 years. In 10 years, I've seen a dentist 3 times.
What was your experience when you saw a dentist during this period? Now you were getting assistance?
We qualified for assistance last year. So all of calendar year 2000, this is 2012. Boom. The majority of 2011 till now. So it's been a little bit over a year. We've had it. And when we did, she said, "Yeah, let's go." So I didn't. I had some things to do with the doctor, but I went back to the dentist. I went to the Miami County Dental Clinic in Troy. When we started there, they had a really good dentist. We both liked him. He was quick. He was efficient. But we ran into problems with scheduling. They had a system where they would call to confirm your appointment for the next day, and if you didn't return the call, they would cancel. Only thing is, the same person that was calling and letting everybody know tied the phone up all day. So after I made 4 or 5 calls and got canceled, the second time I was supposed to go, I had 4 different appointments scheduled for the same thing, until the thought one day said, why don't you just go to a better office and just pay for it? I've had a couple good jobs that paid cash lately, and that's what I decided to do.
During that 10-year period where you were off insurance and not making a lot of money, and you only went a few times, what dentistry did you have done during that period when money was tight?
I didn't do any. Other guys I'd worked with, I'd watch their jaws swell up because they had an impacted tooth, and they often couldn't get antibiotics. I just thought, I hope that doesn't happen to me, because that's when I'll go. I'm going to go when my face swells up and get one pulled.
Now, how many hours a week do you work now as a painter?
I probably work 60 or 70 hours. I mean, when I have jobs that pay, I work. When I run out of work, I work for free. I like to keep working. It keeps me sharp, keeps me ready, and after I work for somebody for free for a while, the phone starts ringing again. So that's the way. I don't put any mailers in boxes or nothing like that. I just go do things that are helpful, and the phone rings.
Okay. how much longer do you think then that you're going to be on assistance?
Well, I've had this business now for almost 4 years, and the first 3 years I declared a loss. We actually stopped calculating our losses when it got to a certain point, but this year it's going to be a gain. Things have finally turned, and I'm not going to be on this much longer. After we declare taxes sometime early 2013, I won't qualify, which is great.
Good. Nice. So you've had a couple of appointments with us here at HealthPark.
Yes.
How would you describe the difference between how you've been treated and what you've learned here compared to what it's been?
Well, it's kind of night and day. First thing I noticed today that I didn't notice before is that you have an area to keep kids entertained and that you care about that. At the dental clinic in Troy, basically it's a free-for-all amongst all the little kids, and the parents take turns punishing the kids and that kind of thing, and the receptionist just stays oblivious to it. But also, you don't have the call us back or we'll cancel you appointment system, and it goes a lot further than that. I picked up on some other stuff, like in the waiting room, you have this hierarchy of who's working for you and what level of education they received. And then there are other things, the way your reception's office is, they greet you, that kind of deal. But that's all big stuff. But for me the difference was when I came back to the chair. Because in the chair what happened, I'm a knucklehead, I'm a hard head. And my medical and dental appointments in the past have been, they tell me to do this and I nod my head like I will, and I don't because I just want to resist. That changed this appointment. I've flossed I know how to floss now. I learned that in my last visit. Maybe I wasn't listening, but the thing that was different is that both you and the hygienist started right off the bat with education. You didn't just tell me to do it or ask me if I was doing it. You told me why and what it does. And when that piece came in the puzzle, now I understood. I thought you flossed to get food out of your teeth, but that's not true. My gums were swollen, and I have to put that floss up between the tooth and the gum to stimulate that, remove the plaque, and that's what will reduce the swelling. I didn't know that. So I don't want that to swell. I don't want to lose my teeth. I like to eat anything I want. So I can still do that now. But anyway, that's the difference. You told me why.
So in the approach that we're planning to use, we would show someone how to become healthy.
Yeah.
Then we'd have them come back in a week or two for a good cleaning, x-rays, and a checkup. And at that time, if their mouth's healthy, then they would qualify for at least $300 worth of dentistry. If their mouth's not healthy, if they're not taking care of themselves, doing what we've shown them and worked with them on, then we're not going to do a lot of fixes. We'll be available to pull a tooth in case they need that.
Right.
But we're not going to put a lot of money into their mouths when they're just going to create more decay.
Makes sense to me.
Well, of the people that you've met, that you've talked to, what percent do you think would be if they had that first appointment in preventive care and came back a week later?
I got you.
What do you think?
At least 80%. There's some people that they're just going to do what they're going to do regardless. But there's a lot that would take advantage of that. People that wouldn't normally meet the eye like you think they would capitalize on it. But I would say probably 80.
Some of the cowboys would be here.
Yeah, they can be reached. See, if I can be reached by the approach you took with me, that covers a broad spectrum. So I'm toward the top of that scale.
Okay.
There.
Well, and you're a really good example, Sean. You're exactly the kind of person that is going to be a success in life, and it was a pleasure to be in a situation where we could help you too.
Thank you. Thank you very much, Dr. Smith.
Thank you. Anything else, hon?